Good morning. My name is Tamika Gilbert. I am the BLS instructor for today. This is the BLS Provider Renewal Course. I'm recording this for review, and this is a mock simulation class for certification for instructor. All right. So my name is Tamika. I am the instructor for the Renewal BLS course. I will be providing your experience today for your renewal certification. And we are in this office. If you'd like to use the bathroom at any time, the bathroom is out the door, and then make a left and then an immediate left, and the bathroom is there. We should be here approximately 3 to 4 hours today. We'll be taking a break approximately halfway through, and then we're just going to power through to get the rest of it done. At this time, I'm going to invite all students to introduce themselves, and then we're going to discuss what is going to be going on throughout the day. Great, great. So today, what we're going to do is we're going to discuss all the qualifications needed to renew. We're going to go over chest compressions and breathing techniques, AED application and when to use it, and then we'll have our skills exam, and if there is any remediation that will be done there. If there are any disabilities that I need to be made aware of so that we can adjust the mannequins, then please let me know at this time. For simulation purposes, for ease of video, we're having the mannequin here on the desk, and I have ensured that my position for chest compressions is proper. All right. All right. By the time this course is done, excuse me, by the time this course is done, I'm going to read to you the objectives of the course. So by the conclusion of this course, as the student, should be able to describe the importance of high quality CPR and its impact on patient survival. You should also be able to describe all the steps of the chain of survival, apply basic life support concepts during the chain of survival, as well as recognize signs of someone in need of CPR. High quality CPR for an adult, child, and an infant will be proficient by the time we're done this course today. Also, you should be able by the end of this course to describe the importance of using an AED as soon as possible. Also demonstrate the appropriate use of an AED, as well as provide effective ventilation using a barrier device. Furthermore, by the end of this course today, we should be able to describe the importance of teams and multi-rescuer resuscitation attempts, and perform as an effective team member, during the multi-resuscitator or multi-team CPR event, as well as finally describe the techniques for relief of foreign body airway obstruction for an adult, a child, and an infant. Okay. All right. And again, this is a renewal certification for basic life support for the professional outside of the hospital. Okay. So the first lesson that we're going to review today is going to be adult basic life support. I'm going to play a brief 10-minute video that's going to introduce our course for today. It is heart disease as the #1 cause of death in both men and women globally. It's going to discuss that, and then it's just going to lead us into our initial start for today's proceedings. All right, okay, so we have completed our introduction video, and we are going to go into our adult BLS. Part 1 is going to discuss the adult chain of survival. Part two is going to discuss the one person rescuer. And then what's going to happen is, and you'll see this during the course of the lesson today, of the class today, we're going to show the video. I'm going to show the video. I'm going to then demonstrate and talk about what we saw in the video demonstrated, and then we're going to practice while we watch. And then, just getting you ready for the end of the course. All right. So this first lesson, we're going to talk about part one. We're going to talk about adult chain survival. And then we're going to talk about in part two, one person rescuer, adult BLS. We're going to practice while we're watching. And then part three, we're going to talk about AED. I'm going to introduce the AED, show how to apply that. And then bag mask technique. Unfortunately, right now, my bag mask has not come in, but we will talk about facial mask. You are already equivalent in that. You are already proficient in that. So we are going to brush on that really quickly, because while you're practicing, while watching, you will be performing chest compressions and face mask or pocket mask use during that practice while watch. We will talk about bag masks later, but again, I don't have that. So we will discuss that and simulate practice with that. All right, so let's watch this first video. This first video should take a few minutes. This first part should take about 22 minutes, and we will be back at the conclusion. All right, so thank you. So we have discussed our we have watched the video, reviewed our basic life support compressions and breaths. So we know that there are 30 compressions to 2 breaths. You saw in the video that they used a pocket mask. Here is our pocket mask, and here is our valve. This is a personal valve. You do not share these, we know that, but this is a personal valve, and these valves are formulated to both adult and child. Let me open this up. All right, so once you, sorry, I already have a valve in here. So once you open your mask up, you'll see that this hole here is open. You'll take your valve and you will place the valve into the pocket mask that way. All right, and when we are doing pediatrics, you'll see that the pediatric cuff or the pediatric mask is this way. You will turn the valve over and insert. All right, blowing in this is a one-way valve. Okay, all right, so we're putting our valve into the adult mask. So we've got our mask laying next to us. This is readily accessible. You are doing chest compressions and breaths for the patient. Patient is unconscious. We're going to first ensure that our scene is safe. We're going to try to arouse our patient, and then anyone who is around, we're going to make sure that we're making eye contact and sending them for appropriate help. Okay. So first thing we're going to do is make sure our scene is safe. Everything is safe. Hey, are you okay? Are you okay? No response. We're going to check for pulse. While we're checking for pulse, we are looking for signs of breathing. There are none present. We're going to, if someone is available, tell somebody to go call 911. Please go call 911. Get somebody here. We're going to start chest compressions, making sure that our posture is correct, making sure that the palm of our hand is in between those two nipples, and not compressing the bottom of the sternum, but directly between. We're lacing our fingers and making sure that we're using the ball of our hands. We're positioned directly over the patient with elbows locked, and we are administering our chest compressions. While we're administering our chest compressions, we are counting out loud. Once we get to 30, then we are going to place the mask on the patient's face. It is okay to leave the mask here, so that's one less thing that you have to do. We're going to do a chin tilt lift pushing the forehead down and administering 2 breaths, 2 full breaths, making sure that we see chest rise and fall, okay? All right, we saw chest rise and fall. We're immediately going back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 5, 6, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 8, 9, 10, 12, 13, 14, 16, 17, 19, 2, 3, 4, 5, 6, 7, 8, 30. All right. I am tired already. You will definitely get tired, okay? But just make sure that your form is correct, and we'll be cycling out as we advance more in the class. Okay, we're going to practice while we watch. Any questions? Let's go. All right, as you can see, he's checking for pulse. He's also looking for signs of breathing, sending somebody to get help. I did forget to tell somebody to get the AED, but we're going to make sure that we do that. And he is doing proper chest compressions, calling them out as he's doing them. Notice he is directly over top of the chest. Elbows are locked. He's placing mask on. He's watching for the chest rise and fall as he gives 2 breaths. And then he goes right back into his compressions. Any questions? All right, moving on. Next, we're going to talk about the AED. This is our AED for simulation purposes. It's kind of standard to what you'll see in a facility. Some may be different, but they all have the same mechanisms, the same operation systems. You're going to power it on. It's going to cycle through. It's going to tell you what to do. And then you're going to give it a shock if needed. Okay. For this AED, then once we put the pads on, it's going to tell us what to do. And we're just going to listen to those prompts and go from there. Okay. So we're going to power the AED on. We're going to go ahead and choose if we're doing a pediatric or an adult. It's already programmed to an adult, so we're going to choose if we're going to do a pediatric for this one. And it shows you on the pads how to place your AED. So please make sure that you are looking to see how to place your AED. Okay, we're going to watch the video, and then once the video is complete, then I'm going to demonstrate chest compressions. I'm going to go through the whole scene, send someone to go call 911, send someone to go get an AED, initiate CPR with my breaths. When the AED arrives, I'm going to place AED on, and then we're going to cycle through and watch that. Okay? All right. Okay, so we have watched the video on AED placement. So first thing we're going to do, check and make sure scene is safe. Tap the patient. Are you okay? Are you okay? No response. You call 911. You go get an AED. I'm checking for pulse. I'm watching for breath sounds. I don't see any. I'm going to initiate CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Mask is going on. Watch 2 breaths go in. 1 more. 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 15, 17, 19, 1, 2, 3, 4, 6, 7, 8, 9, 30. I'm going to give 2 breaths. That's rose and fall. Now our AED has arrived. We're going to go ahead, take our AED out. We're going to power it on.
Patient. If the patient
While this AED is going, we're going to place our AED
pads firmly on skin.
onto the patient,
Apply breast pads firmly on skin.
pressing it firmly on the skin. All
Do
right.
not touch the patient.
We're not touching the patient.
Rhythm.
He's analyzing the heart rhythm. Our hands
Do not
are
touch
off.
the patient. Analyzing heart
We're
rhythm.
not touching the patient.
Shock advised.
Shock advised. We're going to press the red shock
patient.
button.
Everyone clear.
Everyone clear. Clear. I'm
Press the
clear.
flashing shock
Press the shock button. It gave a shock.
Delivered. Begin CPR.
We're going to resume CPR. 10, 11, 12, 15, 16, 17, 19,
20.
5, 6, 8, 9, 30.
30. Give 2 breath.
See, it's going to tell you what to do. Three, 4, 5, 6, 7, 9, 10, 11, 12, 13, 14, 16, 17.
20.
That's going to be 20.
30.
30.
2 breath.
4, 5, 6, 7, 8, 9, 10,
10.
12, 13, 15, 16, 18, 19,
20.
1, 2, 3, 4, 5, 6, 7, 8, 9, 30.
Give 2 breath.
2, 3, 4, 6,
10.
9, 10, 13, 15, 17,
20.
19, 1, 3, 5, 7,
30. Give 2
30.
breath.
All right, I thought it was going to go ahead and analyze rhythm already, but I think this goes through 5 cycles. Once it completes its 5 cycles, it's going to go back and reanalyze the rhythm, and then it's going to advise another shock. And then we'll keep going from there, okay? For the sake of fatigue, we are going to do 3 cycles.
Stop CPR.
It's telling me
Do
to
not
stop
touch
CPR.
the patient. Analyzing heart
It's
rhythm.
analyzing heart rhythm now.
Do not touch the patient. Analyzing heart
This
rhythm.
is why it's so important that
Shock
we
advised.
rotate.
Do not touch
Everybody
the
is
patient.
clear.
Everyone
We want to make sure everybody is clear.
Press the
Okay,
flashing
we're going to
shock.
press the shock button. It
Shock
administers the
delivered.
shock.
Begin
It's going
CPR.
to tell you to begin CPR again, okay? All right. Any questions? Great. No questions. Everybody knows how to do it. We are all exhausted. But we are ready to keep going. Okay. All right. So let's continue. So the next thing we have gone over compressions, breath sounds, rescue breaths. We know it is 30 to 2. That's correct. We know the first thing that we're going to do when we come on the scene is we're going to make sure that the scene is safe. We're going to check the patient's response. No response, we're not going to waste time. We're going to check pulse and breathing, any signs of any signs of respirations. At the same time, we're going to do that simultaneously. We've got our bag, our pocket mask. We've got that available for us. It is ready to go. We are immediately going to start chest compressions because we need to get that blood, that oxygen that's in that blood continuously circulating in the body. 30 compressions. We're going to give 2 breaths by using a chin tilt lift. Palm of my hand goes on the forehead. I'm lifting this up. I am using a C method. I'm holding this down on the bridge of the nose with my C here in the palm of my hand on the forehead, and I'm pushing down on the bottom of this mask. Please ensure that you're doing that. You will not see this chest rise and fall if you are not having this mask secured. You're watching chest rise and fall completely when you are doing these breaths. Once you finish and the AED arrives, you need to put the AED on immediately. The AED will cycle through once you turn it on. Press the pads down into place. If the patient is hairy, you can shave them quickly or press the pad down, rip the pad off, put a new pad on. If the patient is wet, you want to make sure that you dry them. They don't have to be bone dry. You can just do a quick, just getting all the liquid water off of them because water is a conductor and we don't want to put pads on because it will not give the proper shock if the patient is wet. If they are in water, you want to bring them out of the water. They can lie in a small amount of water, but their chest needs to be dry. Any questions? All right, let's keep going. We're going to talk about bag mask. In this next video, you're going to see them use a bag mask, and that mask is a bag that is applied to this portion, the adapter part of the pocket mask, and you are going to maintain that C and E. You're going to maintain that form on the bridge of the nose down to the bottom of the mask. Pocket mask is going to be on. You're going to press. This is going to give the 2 breaths. Instead of you manually putting that air in there, you're going to use the bag. Squeeze the bag. You do not have to squeeze it completely to collapse the bag. It's just a half squeeze, and that's good enough. Okay, so 2 breaths, same concept. All right, let's move forward with that. All right, so we have watched, we have simulated, we have practiced with video, and now we're going into lesson 3. This lesson is mouth to mouth resuscitation. If there is no bag, pocket mask available, we are going to discuss in this portion of the video mouth to mouth breaths, rescue breathing. We're going to practice while we watch the video. We're also going to do breaths with an advanced airway. An advanced airway would be applying, or rather putting in, it goes into the mouth and it opens the trachea, and then you put a bag onto that. We're going to talk about opioid associated life-threatening emergencies, maternal cardiac arrest. We're going to discuss those things, okay? All right, so let's get into these videos. All right, this video is back. Let's go mouth to mouth. Here we go. All right, so we watched the videos on mouth-to-mouth resuscitation, and now, since the video has paused, we're going to practice while watching mouth-to-mouth breathing for adults. So I just want to make sure that everyone is aware you are giving one breath every 6 seconds. That is one breath every 6 seconds. You're going to give each breath over a 1 second interval, over a 1 second duration. Okay, each breath should take 1 second to give, ensuring that each breath results in visible chest rise and fall. You need to see the chest rise and fall. And we're going to check for a patient's pulse every 2 minutes. Okay, we're going to check for a patient's pulse every 2 minutes. So again, you want to give one breath every 6 seconds. Every breath that you give should be a 1 full second in duration, and we're going to check for a pulse every 2 minutes. Okay, so we're going to come onto the scene. We've checked the scene is safe. We've checked for response. We don't get any. We've checked the carotid pulse. We don't see any signs of breathing. We have done. We have initiated the emergency response. We've sent someone for help. We've sent someone for the AED. We don't have a pocket mask available. We are going to do 30 compressions, and then we're going to administer one breath every 6 seconds. So one breath, and then we're going to do another breath, and then we're going to start compressions again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Two, three, 4, 5, 6, 7, 8, 9, 10, going up to 30. Wasn't seeing my chest rise and fall. I got to see it the last time. All right. So we want to make sure the chest is rising and falling, making sure that each breath is that full 1 second, making sure that we're waiting 6 seconds in between. So once you give that breath, we're waiting and watching, making sure that we're seeing that chest rise and fall. Okay. I don't think that I mentioned we need to be pinching that nose because the air will go in and come out the nose. So we want to make sure that we're pinching that nose, lifting the chin, and making sure that we're taking those full breaths. Okay. Well, that mannequin. Whew, that is a job. All right, let's keep going. So we did the mouth-to-mouth resuscitation with children. With children, we want to make sure that we're giving one breath every 2 to 3 seconds. That's about 20 to 30 breaths per minute. And then we want to give each breath over 1 second. Each breath should result in a visible chest rise and fall. And we want to check for a pulse every 2 minutes. So with the child, with the child, with the child, we are doing the same technique. One breath over 1 second duration. But just in the children, then your breath's going to be every 2 to 3 seconds, not every 6. With an adult, it is every 6 seconds. With a child, it is every 2 to 3. All right. So we're going to watch that video, and then we're going to watch the video on advanced airway, and then we're going to discuss if you have any questions about that. Okay. Anyone have any questions on advanced airways? Great. All right. So we are moving on. Going to go to our next. We're going to talk about high performance teams. And in this lesson, this is lesson 4, it's about 26 minutes. We're going to talk about part 1, team dynamics. So the roles of each team member. In a hospital, you're going to have several roles. You're going to have someone who is calling for what medications during the code, someone who is taking time, watching that, someone who is making sure that chest compressions are being delivered appropriately, making sure that those breaths are being done. You're going to have someone on the bag or on the pocket mask or however you have. So we're going to discuss those team dynamics. We're going to talk about high performance teams. All right. And then lastly, we're going to talk about high performance teams activity. All right. And then we'll be finished with this part. Okay. All right, so we have completed lesson 4. We're going to advance to lesson 5, and lesson 5 is child basic life support. So we're going to talk about child basic life support. So we have our child mannequin. We're going to move Mr. Tom out the way and put Tom Jr. in his place. All right. So we've got Tom Jr. in his place, and Tom Jr. here. You'll notice when we are doing our chest compressions on Tom Jr., there is a green light here. That green light will stay as long as our compressions are good enough, okay, are appropriate. If your light turns red, then your compressions are not deep enough, okay? So let's go into the video. We're going to watch how to save Tom Jr. from choking and to give CPR to Tom Jr. We don't want to completely undress Tom Jr. right now. Okay. All right. So let's prepare our small pocket mask for Tom Jr. All right. You remember you put that on the different way. We've got our AED for Tom Jr. And I believe that we are ready to go. I think Tom Jr.'s or Tom adult, Tom Senior battery came off. Okay. All right. Okay, so let's go into our child rescuer lesson, and we'll come back with any questions. We'll demonstrate, and then we'll practice while we watch. Okay. Okay, so in this portion, I'm going to get 2 people. I'm going to get one on breaths and one on compressions. Right now, we are doing a child, and a child, this is 8 years and up. So we're going to use Tom Senior for the child, and compressions to breaths are going to be the same, 30 to 2, okay? 30 to 2. So okay, so we are going to do 2-person rescuer on the child. And so with the child ages 8 and up, the chest compressions to breaths are the same for 1-person rescuer. So if you are 1-person rescuer, it is going to be that 30 to 2, 30 compressions to 2 breaths. But if you are a 2-person rescuer, it is going to be 15 compressions to 2 breaths. Okay, 15 to 2 for 2-person, 30 to 2 for 1-person. Okay, so we're going to do 2-person rescuer, and that is 15 to 2. We're going to go do 1-person rescuer. We already done that. So we're not going to do that, but we are going to do the 2-person rescuer with the child age 8 and up. So that is 15 compressions to 2. Okay. So let's do Mr. Tom. Mr. Tom is going to give us a hand. Let's put Tom's battery back in. And we're missing a battery on Mr. Tom. So anyway, so yeah. So Tom is an 8-year-old child. We got 2-person rescuer. So Mary, you're going to do breaths. Margaret, you're going to do chest compressions. How many? 15. Great. How many breaths? 2. Great. Awesome. So checking the scene is safe. Checking for response. Don't get one. Calling for the emergency response, setting that in place. Somebody go get an AD. Somebody call 911. We're checking for pulse. This should take no more than 10 seconds. We're watching for breathing. We're initiating chest compressions. My second person is ready with the mask on. Bag mask, pocket mask, whatever you got. My second person is ready. We are doing chest compressions. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 2 breaths. Watch that chest rise and fall. Great job. Great job, team. Great job. All right. Let's put Tom Jr. back. We are ready. Let's move on. All right. So let's do our 1-person rescuer for a let me see, this is 2 rescuer CPR with the child. We want to do 1-person rescuer with the child, and we want to do, let me see what the next video, I'm sorry. We got the next video here. There we go. So with the child, what we want to do is we want to watch this video. This is going to talk about infant basic life support. Infant basic life support. There is a difference with the infant. The infant, we're not going to push. We're not doing the palm of our hand. Chests are very fragile. We're literally encircling the chest, thumbs in the center, and pushing down. Okay, pushing down. You'll hear that click. All right, you'll hear that click when we're doing that. So let's watch this video and go from there. Okay, watch the video first, and then we'll talk about any questions. All right, so we've watched the video on infant CPR. And so some things that I do want to go over is that we want to make sure that our infant is placed on a flat, firm surface. Okay, we want to make sure that our infant is placed on a flat, firm surface. And we're going to place 2 fingers in the center of the infant's chest. Okay, this is when you are doing 1-person CPR, and use your dominant hand, but we're going to place 2 fingers in the center of the infant's chest, just below the nipple line. Okay, on the lower half of the breastbone. Make sure that you're not going below the nipple line. That is a xiphoid process, and we don't want to damage or break that. That could puncture a lung. Okay, so we don't want to press below that part. So we're going to place 2 fingers. We're going to push hard and fast at the depth of at least 1/3 the depth of the chest. So 1/3 the girth of the chest is how hard we want to push down. We want to get approximately 1.5 inches or 4 centimeters, and we want to deliver compressions between 100 and 120 per minute. Okay. Let me just make sure that I have everything. We want to allow complete recoil of the chest. So we're not going to go and just, we're not going to do that. You'll see this yellow light saying that's not good. We want green lights all the way. That tells you, see those green lights? That tells you that we've got good compression rate. We've got good compression rate. We've got good depth. If you too much, you'll see. See that light blinking there? That's a red light. That means no. If we're not letting this chest completely go, don't get so excited that we're not doing these efficiently. Okay. So 100 to 120, and we want to make sure that we are compressing 1/3 of the chest. Hear that click? See those green lights? Okay. All right. And then we want to make sure that we are giving our proper breaths. If we're doing two-person rescuer, then the first person is in front with a C formation with the hand shapes, thumbs in the middle, right where your fingers would be. And we're doing 15 breaths. Okay. 15 to 2 with two-person rescue. All right. All right, so we're going to go ahead. We're going to do 3 sets. I just want to make sure that I got everything, that I've said everything. Yeah, we're going to do 2 sets. Let's watch the video. We're going to practice with the video, and we're going to go from there. So first is going to be 1-person rescuer, and then we'll go to 2. So you see, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. 2, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, so we've got our chest compressions in, and now we want to see if this will do our 2-person. All right, so this is going to be 2-person with breaths, and we're going to practice while we watch. Okay, so all right, so we've got our 2-person technique. Remember, 1 person is this angle with the baby, C-shaped hands encircling the baby's torso, thumbs in the center of the chest at nipple line, not below nipple line, thumbs at the center. We're pressing in with both thumbs, a rate of 100 to 120. I'm sorry, we're doing 15 compressions, and then we're doing 2 breaths for the infant. All right, so we're going to practice while we watch. Let's do that. So we're going to assess the scene, make sure the scene is safe. We just watched baby pass out. All right, we're tapping the baby's feet and making sure that baby is okay. We're checking for brachial pulse here. We don't feel anything. Babies, you're not going to check the carotid. We're sending somebody to activate emergency response. We don't have a pulse. We're going to start. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then we're going to give the baby 2 breaths. And then we're right back. 14, 15. And then we're giving the baby the 2 breaths. 2, 6. And then the baby gets 2 breaths. They're using a bag on the screen. I'm trying to keep up with that, but then we're 15, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 2 bag breaths. All right. So that's how that one's done. Okay. Any questions? All right. So we're going to practice that. We're going to get one person first come up. And then after that, we're going to do 3 cycles with one person. One person, remember, it is 30 compressions. All right. 100 to 120. No breaths with that one. And then we're going to do 2-person CPR for an infant. One person is going to be at the bottom. One person is going to be giving breaths. One person with compressions. One person giving breaths. And we're going to do 3 cycles of that. All right, let's get started. We have completed our 3 cycles of 2-person rescuer for a child and infant CPR. Infants are less than 8 years old. For children 8 and up, we're going to use the same as the adult. But for infants, we have practiced the 2 hands C shape around the torso, 15 to 2 with 2-person rescuer, and then with single, we have practiced our 2 fingers in the sternum between the nipple line for the infant, 30 compressions. We are now going to talk about use of the AED with the infant. This is a child up to the age of 7, because age 8 is going to be considered adult. So with the infant, if they have infant pads, you can use that. If not, you'll notice on the pads, it will show you the position for an infant. Normally it is 1 pad in the center of the chest and then 1 pad in the center of the back. Remember to switch your AED device, turning it on.
Adult patient. If the patient is a child, press the child button. Child patient.
All right. So then we have
Remove the
child
child's
patient.
shirt.
It's going to tell you remove the
Remove
child's shirt.
packet and apply pads on the child's bare skin.
Putting the pad on the child's bare skin.
Apply pad. Press pads firmly on skin.
We're putting the pads firmly on the child.
Apply
Again.
pads to child's back and chest as shown in the picture.
All right, you see how it's telling you what to do?
Apply pads to child's back and chest as shown in the pictures.
All right, so we've got that in place.
Press pads firmly on
Press
skin.
them firmly down onto the skin. It's telling
Apply
us
pads
everything
to
we
child's
do.
back and chest as shown in the pictures. Apply pads to child's back and chest as shown in the
Right.
pictures.
Breathing.
Press pads firmly on skin.
Make sure my AED is working right.
Do not touch the
Oh,
patient.
there you go.
Analyzing
So
heart
now it's
rhythm.
going to analyze. It's going to tell you not to touch the
Do
baby.
not touch the patient.
It's
Analyzing heart rhythm.
analyzing.
Shock advised.
It's going to shock it.
Do not touch the patient.
Don't touch. We're going to make sure
Everyone
everyone
clear.
is clear. And we're
Press
going
the
to
flashing shock
press.
button.
They
Shock
deliver the
delivered.
shock.
Begin CPR.
And we're going to make sure that we go back to CPR. All right, we've got
Okay.
2-person CPR. We've done 10 compressions here.
20.
All right, and then we're just going to keep going listening to
Give
that.
2 breath.
So we are still completing compressions. 10,
20.
20,
30.
30.
Give 2
We're
breath.
giving 2 breaths. Watching chest rise and fall. Going back to chest compressions.
10. 20. 30. Give 2
Give it
breath.
2 breaths. Now it's going to analyze the patient. Oh, no, it's going to tell us to go back. It's doing 4.
10,
Now this one's doing 5. Yeah, this one's doing 5.
20, 30. Give 2
We're gonna get
breaths.
2 breaths. Watch your chest rise and fall.
Stop. CPR.
It's going to tell us to
Do
stop
not touch the
CPR.
patient.
Not to touch the patient. It's going to analyze, and then it's going to deliver another shot.
Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear.
Everyone clear.
Press the flashing
We're going to
shock
press
button.
the shock button. It
Shock
delivers shock.
delivered.
All right.
Begins.
Any questions about infant AED defibrillation? Yes, you can do your chest compressions as a single person this way. You can do them with your 2 fingers. If your 2 fingers are, with your 2 fingers, you are not reaching the proper depth, you can use the palm of your hand. Do not lace the fingers, do not put full pressure, but you're using just the palm of your hand. You can do that, okay? All right, we're going to move on to choking. And once we complete choking and foreign body obstruction, then we will move on to our skills test. Any questions? Okay, let's keep going. We have watched the video on choking, and we've got Mr. Tom here who is going to assist us with what is known as the Heimlich maneuver, or just relieving the foreign body, relieving of a foreign body object that's causing choking. So with the patient, they're going to give the universal sign as we saw in the video. Most of the time you'll see it. They're going to grab their throats, okay? They're going to grab their throat. You're going to know that they're choking. They're struggling to breathe. If they're turning blue, that's a sure sign that there's something wrong, okay? So we're going to get behind the patient. We know the belly button is here, okay? I don't need to look at you to know where your belly button is. I don't have to lift your shirt. You can kind of feel where it is through the clothes, okay? So you're going to find the patient's belly button. You're going to make an A. This is A. All right. You're going to make an A, a fist, thumb side in. So we found the belly button. We're going right above the belly button. We're putting that hand over top, and we're giving in and up thrust. Let's get a little closer, Mr. Tom. In and up thrust. Okay, in and up. And we're going to keep doing this until Mr. Tom expels whatever it is that he's choking on. Okay, we're going to keep doing this. Now, if while we're doing this, Mr. Tom doesn't give up what he's choking on and Mr. Tom passes out on us, we're going to gently lower him to the floor and we're going to initiate CPR. The only difference, just as in the video stated, the only difference is once we give those compressions, and we finish those compressions, when we go to give those breaths, we're looking and seeing if we see the foreign object. If we don't see it, we're going to keep on going. Okay? But if we can see it, sometimes that compression, you're going to push that object up into the throat. And if you see it, then take your finger and hook and sweep it out. Try to get it out. Sometimes you might find objects that they have, or devices rather, not objects, devices that they have nowadays where you will depress it, put it on, and it kind of acts like a plunger and pulls it out. If they have that, then that's fine. If you know how to use it, that's fine. We're not going to review that in this class. But you're going to continue CPR until help comes. Make sure that you initiate or activate that emergency response immediately. As soon as they go down, you're going right into You call 911, you get an AED because we want to have everything in place and ready. We're going straight into those compressions. We're giving those breaths, but before we give those breaths, we're making sure that we're looking and seeing if we see any object in the throat that's visible. If it's visible, then we're going to get it. We are not going to perform a blind sweep. Any questions on that? All right, so we're going to practice choking. And we're going to have one person that's choking, one person that's going to administer the abdominal thrust. Now, if the person is overweight, obese, and you cannot get your arms all the way around, or the person is pregnant, then you're going to use, the chest thrust. And that's the same as if they were laying on the ground. If they were laying on the ground, but just they're standing up. Once they go down, we are back to compressions the same way we're supposed to do them, okay? All right, let's practice. We have completed our practice for a number of things today. We have talked about, oh, no, we are not done. We are not done. We have to go over choking in an infant. In an infant, all right? So with the infant, choking in an infant, we are going to do the back thrusts. We see that the baby is choking. Let's take our pads off the baby. We see that our baby is choking. I almost forgot all about it. Let's take our pads off our baby here. Put these back. Okay, so Tom Jr. is choking. We need to do some intervention for him, okay? If there is something that you can put your foot up on, then that's fine. To give you a little bit of leverage, that's fine. You're going to grab Tom Jr., you're going to grab him from his mother. You're going to put your hand to brace his chest here. You're going to lay him over your hand. Legs are straddled. You're going to go ahead, put him on your knee. We're going to do back thrusts. They're going to go upward. We're not we're not doing that on Tom Jr. But we are doing back thrusts, and they go in an upward motion, nice and firm, in between the shoulder blades. Okay, until we see that come out. We're going to turn Tom over, see if we see the foreign body, turn him back over, back thrust, okay? Another way that we can do Tom Jr. is put him on our knee and do our compressions. See if we see the foreign body. If we see it, we're going to remove it. If we don't see it, we're going to keep going. Make sure that you activate the emergency response system, making sure that we're getting everything moving so that it's here when we need it. All right. Okay. Any questions about choking? All right. Let's make sure that we have gotten everything this time. All right. So just to make sure that we reviewed it, we're going to kneel or sit the infant on our lap. If we can easily remove the clothing, we're going to do that. Hold the infant face down, head slightly lower than the chest. I'm sorry, I didn't say that. Resting on your forearm, I showed you that. We're going to support the infant's head and the jaw with our hand. We're going to avoid compressing the soft tissue of the infant's throat. We're going to rest the baby on our forearm. We're going to use the heel of our hand to deliver 5 back slaps forcefully between the infant's shoulder blades. I did show you that. Please do not go down. We're going to go upward between the infant's shoulder blades. Okay. Just want to make sure that I went over everything. We're going to give the 5 back thrusts, enough to try to dislodge the foreign body. After 5 of them, we're going to turn the baby over, see if we see it. And then if we do, we're going to go ahead and remove it. If not, we're going to go right back. Okay. If baby, let's say, turn the infant over while carefully support the head. We did that. All right. Provide downward chest thrust. All right. And so if the baby, is still unresponsive, I already showed you can do the chest thrust, and we're still doing the same thing. We're trying to make sure that we see that foreign body. All right. Again, any questions about choking? Okay. All right. So we have reviewed in this lesson. Let me go back. All right, so we have reviewed in this lesson adult life support. If an adult is found unresponsive, we are going to, one, check the scene for safety. Two, we're going to check for responsiveness. Are you okay? Are you okay? If no response, we're going to immediately activate the emergency response. You go get 911, you go get an AED. We're going to check for the carotid pulse on an adult. No more than 10 seconds. We're also looking simultaneously for any signs of breathing. Okay, if there's none present, we're going to initiate CPR starting with chest compressions at a rate of 30 compressions to 2 breaths. We're going to use our pocket mask. Thank you. We're going to use our pocket mask for delivering those 2 breaths. We're going to make sure that we are using that chin tilt method to get those breaths in. While we're delivering those 2 breaths over a 1 second duration, we're ensuring that we're seeing the chest rise and fall sufficiently. While we're giving those compressions, we are arms locked directly over Mr. Tom, and we are delivering those 30 compressions, making sure that the chest fully recoils in between each compression. All right. When the AED arrives, we're placing the AED on Mr. Tom. We're powering it on. We're continuing, and we're doing everything. We're continuing. If it's 2 people, one person's going to continue CPR while the other is putting that AED on. If it's 1 person, you're going to end with compressions, put the AED on, cycle it on, turn it on, put the AED on, let it do what it does, and keep on going. It's going to tell you what to do. It's going to keep running you through those cycles until help comes. Once help arrives, then you're going to go ahead and let them take over. All right. With a child, 2-person rescuer, the breaths to compressions are 15 to 2, 15 compressions to 2 breaths. There are 2 ways to do those compressions. You can do an encircling the torso with your thumbs, making sure that you're compressing at least 1/3 of the chest with the baby, and you're giving 2 breaths. Or you are doing the 2-person, and that is 15 compressions to 2 breaths. Make sure that the chest completely recoils, completely, you see a rise and fall of the chest with each breath. Breaths in an infant is 1 breath every 2 to 3 seconds. And so it's going to be an accumulation of 20 to 30 breaths per minute. In an adult, it is 1 breath every 6 seconds. Okay. All right. If your patient is choking, for an adult like Mr. Tom, you're going to get behind them. You're going to find the navel, put your fist with thumb side in directly over in between the navel and upper chest. You're going to do in and upward thrusts, until they expel whatever it is they're choking on, or they pass out. Once they pass out, we're starting CPR. Initiate that response, that emergency response, and we're going right at it, those chest compressions. The only difference is, before we do a breath, we're checking that patient, we're checking that person to see if we see the foreign body. If we do not see it, we will not perform a blind sweep. If we see it, we can remove it and then continue. Once this patient has recovered and spontaneously started breathing, we're going to turn them on their left side and still wait for help to arrive if it has not arrived already. With John Jr. here, or Tom Jr. here, we are giving back blows by bracing. We're taking him from his mama. We're bracing him, the front of his chest. We're not choking him. We're bracing the front of his chest. We're laying him over. We've got our knee up on something, and we're delivering those 5 forward back blows, turning him over, seeing if we're seeing that object. If not, we're not doing a blind sweep. If we see it, we're removing it. Or we are placing Tom Jr. on a flat surface and we're doing those chest compressions until we see that body, that foreign body, and we can expel that from him. All right. Any questions? We are going to start our skills assessment and go from there. All right. Thank you.